So, Dr. Dept, if you want, since we have these folks here in the room, I may go ahead and start with them and then take questions on the phone. Hopefully we're close enough that they can hear your questions, but we might get asked to kind of repeat the question before you answer it. So I'll just kind of say hi to everybody and then we'll get going.
Do you want to ask questions?
Good afternoon, everyone. This is Shelley Walker at the Tennessee Department of Health. We appreciate your joining us this afternoon. We do have a couple of people here in the room with us, along with Dr. Tim Jones. That's Timjones. He is our state epidemiologist and assistant commissioner for our Division of Communicable Environmental Disease and Emergency Preparedness. I hope everyone received the news release we issued this afternoon about our first case of measles in Tennessee this year. We are happy to take your questions about this. We will not be able to provide any specific information about the patient involved, but again, happy to take some additional questions that you might have about this situation and what Tennessee is doing to protect Tennesseans against the measles. We are going to start with questions here in the room, and then I'll give those of you on the phone an opportunity to ask your questions. So Dr. Jones now will go ahead and we'll take questions.
Channel 2 just walked in. You want to give him a second?
Okay, one moment. We've had one other person join us. Sorry.
You want to come over here? It might be better for you.
While we're getting set up, I would love to kind of take roll and see who we have on the phone. I realize this may be a little awkward with folks talking over one another. So can we just start with whoever wants to go first? Let me know your name and your organization, please.
Blake Farmer, Nashville Public Radio.
Good afternoon, Blake.
Travis Bowman with the Knoxville News Sentinel.
Hello, Travis.
Zach Irby with WJHL in Johnson City.
Good afternoon, Zach. Do we have anyone else on the phone with us this afternoon?
This is Jane Harper with the Northeast Regional Office.
Good afternoon, Jane.
Hey, this is Mallory Cook with the Jackson-Addison County Regional Health Department.
Hi, Mallory.
Hi, this is Shannon Smith with WBIR in Knoxville.
Hi, Shannon.
I've never done a call like this. I'm not sure what you do.
Okay, we are getting set up. We've got some folks here in the room with us too. So for those who may have joined late, this is Shelley Walker. I'm the Director of Communication and Media Relations for the Tennessee Department of Health. We have Dr. Tim Jones here with us. He is our state epidemiologist and our assistant commissioner for our Division of Communicable Environmental Disease and Emergency Preparedness. That's a lot of words. If anybody needs a specific title or needs me to spell that out for you, feel free to reach out later. I'd be happy to get that to you. We are not going to be able to provide specific information about the patient or case that we announced today. This is our first measles case in Tennessee this year, and with what's going on in other parts of the country, we knew people would have questions and be curious about what Tennessee is doing to keep Tennesseans protected against the measles. So we are going to start with questions from those here in the room. Dr. Jones will be available to answer your questions, and then we'll take questions from those on the phone. So I think we are ready to get started. So I will give you Dr. Jones.
So this is the first measles case in Tennessee history since when?
We have 1 to 2 cases a year for the last decade or so, but it's essentially been wiped out here. The cases that we do see are or have been almost always imported from other countries where they're having outbreaks or where it's a more common disease, but here it's very, very rare because of our high levels of vaccination.
Was this measles case imported from another country?
This particular case I can't comment on, though I will say, well, one of the problems now is that there's a big national outbreak. There have been over 550 cases so far this year in 20 states. So once it's becoming that widespread in other communities, it's, you know, it was almost inevitable that we would start seeing it here.
What concerns you, based on what you just said, with this one measles case?
Measles is one of the most infectious diseases that we know of and that we still deal with here. So it's very, very easy to spread compared to a lot of other diseases that scare us. So anytime that we see one case, there's a very good likelihood that we will continue to see others spread from that case.
What is the response from the state of Tennessee when there is a measles case?
The measles vaccine, which is widely available, is one of the most effective vaccines that we have. And therefore, the highest risk of spread from a case, once we identify it, is to unimmunized people. Now we have, you know, quite high rates of immunization across the state. It's a vaccine that everyone should get sort of with their childhood vaccines between 12 and 15 months, and then again before kindergarten. So the really high-risk groups are infants that haven't had a chance to be able to be vaccinated yet, or people that have cancer or other immunocompromising conditions. And they're really the ones that are at highest risk of getting the disease from people that have it. Unfortunately, in this national outbreak, the large majority of cases that we're seeing are from people who have chosen not to be vaccinated, which really puts the people around them at risk.
Do we know the percentage of people unvaccinated for measles in Tennessee?
Not precisely. It's probably, you know, in the single digits. There are lots of people that have had some vaccines and not others, so it's a little bit hard to keep, you know, to have a perfect number. Really, our rates of people who've just completely refused vaccine is, you know, under 2% or so, but it's unfortunately going up, and it's much higher in some of the communities in other states that are experiencing these big outbreaks.
What's the tipping point for a single case of measles and the anti-vax percentage going up? What's the tipping point when those two come together? Is it 10%? Is it 8%?
So with diseases that are easily prevented by vaccines, if a very high proportion of the community is vaccinated, it kind of makes everybody safe because there aren't enough people to spread the disease around to put unvaccinated people at risk. It sort of depends on the disease, but once you get, you know, below the mid to high 90s, so you get down to the 95% level, the 90% level, as they have unfortunately started to see in even some European countries. Once that level drops down below that number, then these diseases can really spread like wildfire. Luckily, so far, even in the places where they're seeing outbreaks in other states, the numbers, it's happening still in unvaccinated communities because the overall level in the population is high enough, but we certainly don't want to see it start getting any lower.
Any other questions from those in the room? Okay, the folks on the phone, are you able to hear the responses well?
Yes. We can hear it well, although Dr. Jones, if you were any closer to the speakerphone, it wouldn't be terrible for the radio.
Okay,
Yeah, that's helpful.
thank you, Blake. We are gonna, what I'll do is I'm gonna go down the list of those that we signed in here. So Blake, we'll start with you.
Great. I think I've pretty much got this. I've just been trying to understand sort of like what level we're at when you talk about one case. I mean, it sounds like we've had 15 over the last decade. One case a year is not that rare. So is there some reason that we're more, is it simply because you've seen outbreaks elsewhere that you're a little more alarmed?
Obviously the national context of having hundreds of cases and in 20 states and seeing continued spread from multiple sources raises the angst here in general. I will say though that for a disease like this that has, previously been almost wiped out in our communities, local transmission, we take one case really, really seriously. And so those 1 or 2 cases per year that we have seen, we sort of go wild in a cautionary sense in terms of personally tracking down individuals that we think are high risk, that have been in contact with these cases. We do lots and lots of interviews. We vaccinate close contacts to these cases. So we're very, very careful and aggressive about doing that. And that's the way that we have kept these numbers really low. Several years ago, unfortunately, we did have a case that increased, that had several people around them that did become sick. Those are the kind of things that are really scary. Again, most people that get ill from these contacts have not been vaccinated, but this is one of those diseases where one case gets us very, very excited and activates us.
So other than infants who haven't been vaccinated, do folks who've been vaccinated have anything to worry about as far as for themselves?
If people are completely vaccinated, meaning that they have 2 vaccines, their risk is very, very low. Like, this is a 97-98% effective vaccine, and that combined with a really low risk of being around someone means that it's one of the best vaccines that we have. So the ones we're really worried about are infants who haven't been vaccinated, or anyone who hasn't been vaccinated, the immunocompromised, or people who may have had 1 shot in the past, but maybe kind of missed their second one. And it's really the full vaccination that gives you that really, really high level of protection. But anyone who's out there who's had both of their vaccines appropriately, pre-school and school-age vaccines, can really rest comfortably tonight and not worry.
And I'm sorry if I didn't get this in the last thing. Did you give us the age and any more geographic detail about where this person is?
It was in the east part of the state, and unfortunately I can't tell you the age.
School age even? I mean, is there
Sorry.
any? Okay. Why is that? I'm a little surprised if you can't say anything more specific than that.
Yeah, I mean, we're just, just like we would protect you or anyone else, particularly when we have just a single case. And
you're saying any information could identify them.
Yeah, exactly. So when it's an unusual disease and a single case, it gets pretty easy. In this case, the public message is the same for everybody.
Gotcha.
So we've heard a lot about measles. Can you tell us about the disease? I think some people have missed how dangerous it is.
Yes. I think a lot of times, for diseases like measles that we just don't see anymore, we forget how serious it can be, and we sort of think, oh, that's a childhood disease, it's gone, and we don't worry. If we start asking that question of our grandparents, who actually saw this disease and may well have seen friends of theirs die from it, it's a reminder that these are still very, very dangerous. 1 to 2 out of 1,000 people will die from it. Worldwide, there are tens of thousands of people that die from it. And even, so this is a disease that causes sort of cold and flu type symptoms early on, and then develops into a rash which can spread over the whole body. But people can get sick even after the rash develops, and people can have pneumonia. They can end up in the hospital, quite sick.
Okay, Travis, do you have any questions for Dr. Jones?
Yeah, I think really my main question was which county, but it sounds like you guys are not going to say that. Is that correct?
That is correct.
Okay, so East Tennessee, is this the first case that's been reported in East Tennessee in how long?
Honestly, I don't know the geographic spread of previous cases, but given that we've had one or two peppered around, I don't think over time that there's been anything, you know, anything clustered in a particular part of the state.
Okay, that's all I have.
Okay. Zach, do you have any questions?
Yeah, I guess what's the main takeaway that you want the community to know following this reported case, I guess?
I really think that the main message here, and it's one that we hammer home, is people need to get vaccinated, and they need to be fully vaccinated and get their entire series. Not only does lack of vaccination put that individual at risk, even if it's their personal choice, but when people get these diseases, they're putting other people in the community and the people around them at risk. And a lot of those people don't have a choice about their vaccination, and that, you know, that's just unfair to everybody.
Shannon, do you have any questions you'd like to ask?
Yeah, I just want to ask a question specific because I'm reporting in East Tennessee, so this is where it is. This is where people are wondering what's going on. What would you tell the people here in East Tennessee regarding how likely they are to catch this one case of measles?
The risk is very, very low, and I think this is just for the general population. This is just a reminder that we always want to be careful, and that there's an easy and effective way to prevent disease. So, you know, no one should be losing sleep over it, even in East Tennessee. People that are very close contacts to this case or others, if we see them, we're out there talking to you, we're finding you and telling you and getting you vaccinated. So if we haven't found you, you're at low risk, and it's just the general message.
Thank you.
Okay, any other questions in the room? Any other questions from those on the phone?
Shelley, this is Jane, and I was looking over the clinical testing guidelines, and it talks about travel to an outbreak state is so for our clinicians, and I heard Dr. Jones say that there's up to 20 states or fewer, or maybe a few more than 20 states. So should we have a list of those states for our clinicians to ask people if they're doing testing?
So just to clarify, yeah, it's 20. Well, I guess it's 21 states now. There is a list and a map on the CDC website.
Great, thanks.
Yeah.
Our information probably will not yet be reflected on that map. We would expect that to happen within the next few days. Dr. Jones, is there anything else you want to add?
No, I think we have it covered.
Okay. Well, those of you here and on the phone, if you have any follow-up questions for me, I'll be in the office the rest of the day. You should have all my contact information on our news release that we issued. We do not currently plan to issue any more information to media or the public before Monday. So just want to let you guys know our offices are closed tomorrow, And at this time, we are not planning to share any additional information before Monday. And honestly, at this point, we don't have any additional information to share. So thank you again for your interest in talking with us and with sharing this information with your communities. We really do appreciate your help in helping us get the word out. So again, feel free to reach out if you have any additional questions, and we will certainly share more information as we receive it. Have a good afternoon, everyone, and have a great weekend.